So this is Lupus part 3. So after being told that by my doctor, I got sent to an internal medicine specialist, which was actually referred to me through the hospital. So I went to see him, and he heard my whole story about the fatigue and all of that, and he did some blood work, and when it came back, he said, yes, you do have high ANA, but that's just one marker out of 4. So, he was like, there is a possibility that something is going on, but the only other things that really showed up was a slight vitamin D deficiency, which is more than common for the average Canadian. Very low ferritin, but my B12 was fine. I think my liver function was a tiny bit off, and perhaps my sodium was a little bit low, and my good cholesterol was low as well. So, he was like, I don't think anything is really going on. I think you have fibromyalgia. And my doctor basically, was like, I think you have fibromyalgia too. And things just continued to get worse. I eventually ended up in a wheelchair, and it was pretty discouraging because I couldn't even really turn the pages to a book. Holding utensils was really tough. I couldn't walk to the bathroom on my own. I had to be carried to the bathroom. I had to be helped bathe. And I started to become very depressed, starting to question my life. Like, if I can't even turn the pages to a book, good luck with much else, so I got sent to this psych ward very fast. And there they basically said the same thing too. You're very depressed. So they sent one of their rheumatologists up, and, he was like, you're fine. This is ridiculous. You're obviously in the psych ward, and you're obviously just crazy. So, and I just broke down. I just absolutely broke down. And I remember saying to one of the nurses, like, how come I can feel the weather? You can lock me in a closet and I can tell you what the weather is. Depression can't do that. And I was Miss Grumpy Pants. They were like, you need to walk, you need to not use your wheelchair because although it's supposedly very painful, which we believe because you're crazy, you're depressed, you need to walk. And so I was like, fine, I'll run a marathon. Like, I was so, I feel bad for those nurses. I was a pain in the butt. And, things just continued to get worse. And, eventually things did start to get better. And so I thought to myself, maybe things are getting better. And my doctor, found out from one of her doctor friends, I guess, that they had a patient as well who had pretty well the exact same symptoms, and they were starting to wonder if it was caused by period, which is something that is used for erosive esophagitis, acid reflux, GERD, stuff like that. So my doctor was like, you are on this medication, so let's take you off and see what happens. And after about 5 months, 4 or 5 months, things did start to get better. So we thought, oh my goodness, like that's exactly what it was. I am cured. And the pain was still there, but it wasn't as severe. I could function. It almost was like I forgot how debilitating it was. And pretty well the exact same time the pain started the year before, it started up again. And exact same pattern. I ended up in a wheelchair basically the same time that I did the year before. And my doctor was like, something is going on. We need to keep investigating. So I saw a neurologist, and she was like, you're fine. I got some x-rays done just on my feet and my hands. And there was quite a bit of inflammation in the joints in my feet. And so my doctor was like, this is not normal. We are going to have you see a rheumatologist. But I think I was referred to the rheumatologist quite a bit beforehand. It took a year before I got in to see the rheumatologist. So I went to see him. And right before I went to go see him, my doctor had tested me for, I think, Lyme disease, and a couple other things. Probably MS, maybe rheumatoid arthritis or something like that. Because I did only have one marker. So he saw me, and I was slightly a disaster. Because, you know, could you say I was feeling sorry for myself? Yes. But I was just at my wit's end. It was just like, you know, doctors are not believing me. They're not taking me seriously. This is not something I'm making up. I don't hang out with friends. I have an eating disorder and love to over-exercise and abuse my body, and I'm not doing that. I wouldn't not be doing that by choice. And there was some other stuff too, where I don't really want to go fully into it, but I had been through some pretty extreme exercise in the past, kind of like a boot camp. So, you know, I was like, I know how to push through pain. This is not just normal pain. So I saw the rheumatologist, and he was like, I think you're okay. But I do think you have fibromyalgia. So, no. Diagnosed. You have fibromyalgia. And he tried me on prednisone. And that finally started to work, and it was great, and I didn't even really realize that I was slowly starting to get better, but I could turn pages, I could pretty well do everyday things. I still was in extreme pain, I still was having to take my Tylenol 3s, but it wasn't nearly as debilitating. I could take care of my basic needs. And I am at the 8-minute mark. So, I guess you'll have to wait for part 4.